The views, information, or opinions expressed during the Lex Talk More Action podcast are solely those of the individuals involved and should not be construed as advice, nor do they necessarily reflect the views of Community Action Council's governing bodies, leadership, or staff, or our funding partners. Community Action Council is a private, nonprofit, and nonpartisan organization. We do not support or endorse any political candidates.
This the city's #1 podcast. Love the topics, the guests, and all of the contrasts. They ain't focused on the views and the traffic. What's the point of shining if no jewels for the masses? We gotta spread the news of our passion. Service is a verb, now that's community action. Yo, everybody let's talk. Nothing talking ain't enough, so everybody let's walk. We all want freedom, the eagle and the stars, but the only way to reach it, meet the people where they are. Unity's the only way to fend these atrocities. You and me together can eliminate poverty. And this is just a vessel of expression to make sure we stay on the message of progression. Yes, everybody let's talk. Bring your ideas and together we walk. Protect our seeds from the poisonous root, and we gotta reach the source and the soul and the root. Yes, everybody let's talk. We need community action. Together we walk. Together we work to reduce violence. Speak through the airways. We refuse silence. Let's talk.
You are listening to Lex Talk, More Action. I am Cameron Minter. I am your host, and I'm not co-host. That's what. Let me get it right. I'm the co-host. I'm introducing Sharon Price, our host. What's going on, Sharon?
Hey, Cam.
We're back in the saddle.
Oh, yes, we are.
It's time to get it going, and we're coming back at a very serious time.
It's Suicide
right
Prevention
now.
Month.
Suicide Prevention Month.
That's a big topic.
Yeah, and we've noticed since the pandemic, more folks is deciding to take care of their mental health as opposed to just their physical health, which some of us still ain't doing that, amen.
Well, you're doing something.
I'm doing
Cam.
something, but I'm doing something.
Yeah.
I could be doing a whole lot more. I used to say I don't take credit for what medicine is doing unless I put something to it. So.
Oh, okay.
I got to put something with it now. I got to do something with it.
Do something with it.
That's
but
it.
Kim, let me ask you something. Have you ever felt heavy feelings and heavy thoughts?
Absolutely, all the time. I mean, and you just feel like sometimes you're just under attack, and what you gonna do about it? You know what I'm saying? There's a place of loneliness and surrender and you know, just depression that you can go to. But if you don't want to go there, what are you gonna do? What are you gonna do about it?
Yeah, there are options. There are options. You can get to a place, but that's not the place that you have to stay.
That's it.
Because there's help out there for you.
Absolutely.
You know, for everybody.
Everybody.
And, you know, taking care of your mental health has been a barrier in the African American community historically.
Say that.
You know, because people look at it as a sign of weakness, and you're just not strong,
and that's how we were raised. We, you know. I have to watch some of the things that I say, but, you know, when raising boys, you tell them don't be crying. Man up. And that manning up has hurt us sometimes. So
That's right. That's right.
We ain't no medical
and the same for women, because women have had to be strong in families.
Absolutely.
And, you know, all the way around.
Absolutely.
And being responsible for everything.
That goes back to our heritage of why the women had to be that way.
Well, absolutely.
Yeah, so.
But we've got somebody in here today that's
yeah,
going to help us
we ain't no
with
medical
this.
professionals.
No, not at all.
Don't listen to us.
No, the only thing I say, you don't take everything I say. But,
Right.
You know.
Right. Look that thing up.
Do some research, but
That's
we don't
it.
have to do it today because we've got Daisy Brown, and I said it right today.
You almost, but you stumbled. We saw the stumble.
I did. When you know somebody with the same
That's right.
name for 30 years,
Yeah.
it's hard for me not to say Daisy Thomas.
Right.
Now, but it's Daisy Brown.
It is Daisy Brown.
Yes.
It is. How are you all today?
Oh, we're good, and we're so glad to have you all. We're talking about, you know, this is Suicide Prevention Month, and you do a lot of work. Tell us about your business.
So I own the Champion Therapy Center. We are based here in Kentucky, but we are branching out into other states, and we do all types of mental health counseling. We do crisis prevention for those that are experiencing thoughts or feelings of suicide, depression, anxiety, whatever they're experiencing. One of the things that we tell everybody has mental health, but everybody doesn't have mental health illness.
Right.
And so there's a difference. So all of us have, happiness, sadness, where we live, what we do.
And that's normal, right?
Yes, absolutely, absolutely, because life happens to us all.
Right.
Like somebody dies in all of our families. Somebody's struggling with addiction in all of our families. It's like nobody escapes this. And so making it a normal thing to seek out help is one of the things that we specialize in, that it's normal to have somebody to talk to.
And you don't have to worry about it. It's private. It's confidential.
Absolutely. What happens in this office stays in this office. Only time it's not that way is if you're talking about hurting yourself, hurting someone else, or someone is hurting you. Then we have to bring in other people to make sure that you're safe and society's safe.
Perfect. Yeah. So tell us about, with it being Suicide Prevention Month, what are some of the warning signs that family members might be able to look for, if they have someone that they're concerned about?
Well, a lot of times the signs are there, and one of the stigmas is if I ask them about it, then I'm going to put the thought in their mind.
Right.
No, if you ask them about it, they probably already had the thought in their mind anyway. You're not putting something there that hasn't already been there. But if they start feeling, hopeless, they start withdrawing from family members and friends, they don't do the things that they normally do, their hygiene changes, they don't go out, they start isolating, they start doing dangerous things like driving really fast. They start, talking about being hopeless, or they start giving away their prized possessions.
That's a sign.
That's a sign. When they start giving away things that mean a lot, or start saying sorry for a lot of things, or feeling like they're a burden. I just don't want to be a burden to anybody anymore. There are a lot of signs like, okay, let me give you this. I want to make sure that you get this. Start asking questions. Start saying, okay, are you doing all right? And don't be afraid of the answer. And don't make people feel like they have to put on a facade. Let them be them genuine selves. They can say, hey, I don't feel all right, and I feel like nothing's going to get better. Hopelessness is a real sign of suicide and depression, because what they feel right now, they feel like it's going to always be that way.
And so when you get the information that you may expect, but you're hoping you don't get, right? Because sometimes we ask questions and we don't really want the answers, or we don't know what to do with the answers that we get. What do you do if you get that type of information?
The best thing you can do first is not judge them and say, how can you feel that way? Your life ain't that bad.
You got everything you want. You have everything you need.
Yeah, I don't understand. That's just so selfish. The worst thing you can do is make somebody feel judged because of the way they feel. Nobody wants to be depressed for real. Nobody wants to be sad for real, but it does happen. So once you get that information, don't judge them. But at that time, it's a good time to embrace them and say, you know what, I'm here. I'm here for you. Not only am I here for you, but there is a whole medical profession that's here for you as well.
And
yes.
That's great advice, because one of the things that even in my faith, we always want to go, hey, you God's got you. You're not gonna, And sometimes they just need you to listen. Yeah. And be supportive.
Yeah.
And then we can do strategy later. But right now, let's listen. Let's get your concerns. Let's see where let's really pinpoint where we're going.
Yeah. Absolutely. Being able to be there. And if somebody says that to you, one of the other priorities is to keep them safe. Don't leave them by themselves at that time. Don't take that information and be like, all right, well, I'm going to pray about it, and we're going to see how you're doing tomorrow. Right. Nope, I'm knocking on your door, or I'm sending somebody to you.
Right.
So you don't leave them alone at that time. At that time, it's like, okay, sticking closer than a brother. It's just like, I'm here, I'm in your face, and I'm in your space, and I'm not leaving until I make sure that you're okay. A lot of times people say, well, I don't want them to be angry with me. And I said this to someone yesterday. I said, either you can allow them to be angry or you can plan their funeral. Which one you want to do? And they were like, yep. And
that's
I know that's heavy and that's very direct. But which one do you want? I'll let you be mad at me all day long. But what I don't want to do is plan your funeral, and I don't want to attend it. So be mad. But you'll be alive and mad.
That's how we are with our kids too. I mean, if you engage in real parenting, your children are gonna like you all the time.
Oh,
but
yeah.
You're responsible.
Yeah.
You have some obligation there. So even as friends, we're going to not overlook it. And as guys, first thing we want to do is joke about, boy, you all right? You sounding kind of soft,
Yeah.
you know. But it's an opportunity that someone is opening up, and
Right.
we really need to, you know, hey, well, let's go to a game. Let's do something. Let's spend some time together. Yeah.
I think connecting with people where they are in that moment and really reassuring them that it is just that moment. It's not a lifetime. You think about some of the things that you've gone through in your life, you're like, I don't know if we ever coming out of this. And that's way back in your rearview mirror now. But at the time, it seemed like it was right there and it was always going to be that way.
Right.
No moment is forever. It's just right now.
And I don't know if you've seen the new Tom Hanks, I guess it's new, the Tom Hanks movie where I forget the name of the guy, but he was trying to commit suicide, and his neighbors kept interrupting him. And when they interrupted him, his focus changed from what he was trying to accomplish and began to be focused on them and began to see that there was still more in life that he could provide. And it's a good movie. I have to figure out what the name of it is.
Yeah, please let me know. Yeah, I think that's important to, when people cross your mind, take a moment. Don't be so caught up in your own life that you forget to take a moment and say, hey, you good? You on my mind? They have it now where the cell phone systems, I guess all of them have adopted the text and call line. It is actually 988. You can text it or you can call it, and it's a suicide hotline. So you can, if you call it, if you dial it, then somebody will be on the other end to answer. If you text it, they'll be there to text with you back and forth. And so, I mean, it's like 911 now, but it's 988. And so if you find yourself in a space where you're feeling kind of hopeless and you just need somebody to talk with you 24/7, there are no holidays and there are no breaks. 988, you can text it, you can call it, and somebody will be right there to answer you and just kind of talk you through where you are in that moment. That's what therapists do. We help you to see, okay, if you're in this space right now, one, how'd you get there? Because sometimes it can be history. You know, some factors that you look at when it comes down to people and whether they're at risk for suicide. Is there a family stigma or a family, I would say, generational thing where people have committed suicide in their family? Do they have a diagnosis like depression, bipolar, or schizophrenia or something like that? Do they have those things in their life? And that kind of gauges where. Have they ever attempted before? That's a real factor. If somebody has ever attempted before, you don't play with any of that. You're like, okay, because for us as therapists, if somebody comes into our office and they say that they've attempted suicide before and we start noticing behaviors, they don't get a pass. We have had it where people don't leave our office. They don't leave our office by themselves. They leave our office in an ambulance and that's because we love you enough that we're not going to let you walk out of here. And it's
So I have a question.
Sure.
Does someone, is it a progression? Do you start with maybe depression or something like that builds up to suicidal thoughts? And you mentioned the generational. Is suicide a generational thing?
It can be. One of the things that I think people don't realize is depression and having an imbalance, an emotional imbalance, sometimes it can be chemical related to your body. You can, your body might not be balanced emotionally and chemically. And so that's why medicine is prescribed, because there is a chemical imbalance in your body and you can't pull yourself up. And no matter how many bananas you eat, it's not going to increase your serotonin levels to make it so that you're balanced emotionally and mentally. And so people shy away from medicine and like, no, we're not going to do medicine. But sometimes there's a chemical imbalance that there's nothing you can do about. You don't know why you're constantly feeling weighted. And that's when doctors come in and they say, hey, you have an imbalance. Let's give you this medicine that's going to get you back to being level. And so sometimes if generationally there's a chemical imbalance, then it can be a generational thing. You know how they ask you, did your parents have?
Right.
Uh-huh.
We think it's just because they want to know how mom and them cooked. It's not. Usually if mom and them cooked with a lot of sugar, they feel like you're going to cook with a lot of sugar. If mom and them cooked with a lot of salt, they feel like you're going to cook. Yes, so that's why they look at the generational thing. And we don't think about it generationally when it comes down to mental health. We only think about it concerning diabetes and high blood pressure and things like that. No, sometimes it is generational.
Wow.
Go ahead.
Well, and so I just always have a lot of questions
And
every
I
time
like answering them.
every time I'm with you. So as an employer, and I hear the music coming on, so we can talk about this after the break. But as an employer, if I have an employee or anyone that's listening has an employee that is suffering and is having suicidal thoughts, when we come back from the break, I want you to tell me what I should do and how I should handle that.
Absolutely.
Because we want to make sure that all of our employees and our families and everybody, are as well as they can be. So we'll be right back to talk about that after the break, Cam.
You are listening to Lex Talk, More Action.
This past year has highlighted the strength of Community Action Council. Every day, our staff works together to help families recover from this crisis. We're educating children at home and in person, helping parents who lost their jobs, and helping households avoid eviction. Our work at Community Action Council has never been more important than it is right now. So why don't you join us? We have employment opportunities requiring a range of skills from entry level to advanced. Apply online at commaction.org. That's commaction.org.
I love Head Start.
Children love Head Start, and you will too. Community Action Council's prep academies are hiring now. Head Start is an early childhood education program for children from birth to age 5. Help us give more children the Head Start advantage.
Teacher, what are you waiting for?
Join our team of dedicated education professionals. Apply online today at comaction.org. What are you waiting for? You're listening to Lex Talk, More Action, and our guest today is Daisy Brown, and we are talking suicide prevention because it's Suicide Prevention Month.
And so during the break, we were having an interesting conversation, and I asked you we were talking about generational things. And, you'll see when you're talking about looking back, and when you look back at people who grew up in an abusive relationship, then sometimes they find mates that are abusive, and then if they leave that mate, then the next mate is abusive. Why do we see things like that, do you think?
I think a lot of times abuse can feel normal. Like if you were raised in an abusive home and you're used to fussing and fighting and chaos, to go into a house of peace, it feels weird. And so there are people that will sabotage their lives because what their normal is chaos. And so they will leave one relationship and go into another one, even though they say that's not what I want. But sometimes it's a gravitation to somebody who is strong and aggressive and assertive because that's what you saw growing up. And so you will replicate all the things that you have seen, even though you say that's not what I want, but you keep going into the same relationships the same way. And you have to break the cycle. Like the first time it happens. Like you don't wait until after, well, they said they were sorry. Well, they'll have to be sorry with someone else, not with you.
Yeah, I always look at the common denominator. You keep having bad relationships, but you keep picking them. So
yeah, that's when you stop picking and you pick you.
Right.
You pick yourself. And you pick yourself and figure out how to make sure you're whole and that you're healed and that you see with clear vision, because sometimes we don't see when all the warning signs are there, the flashing lights are there. And it's just like, oh, they really don't mean that when they're going through my phone or they're following me or they're checking and like I seen you smile at him and all the things that go with that. Oh, that's just them showing me that they love me. Is it? Love don't look like that in my world.
Oh.
Yeah, that controlling thing doesn't look like love to me. So, like, knowing the signs, but sometimes people don't, and then they'll get themselves in relationships, and it's just like they'll get really sad and depressed, like, I just keep doing this. I don't deserve to be loved. And it's like, you do deserve to be loved.
Everybody deserves to be loved.
You just got to have a different definition of what love looks like.
And so how do you get people, when people come to you in these types of situations, how do you get people to know that they deserve to be loved? How does that work?
A lot of times we can sit and begin to list their assets, like their resume. I don't send an employer my resume with all my deficits on it.
Right.
I usually send my resume with all my pluses.
We're gonna hide
Yeah.
We're not going to talk
that
about
on
whether
your
I'm time management or not, like I'm good at it. We're going to talk about all the positive accomplishments.
That's it. That's it.
And so we will sit down and write their resume of accomplishments of who they are, the different things they've overcome, their different dreams and aspirations to help them see the bigger picture of who they are versus who people say they are, or even how people treat them.
And I'm so tired of how people say that somebody else is who they are and give them a definition of who somebody else is.
And they most of the time don't know who they are, but they can define who you are.
Right, absolutely.
Like, who are you, though?
Stop it.
Stop judging people. Stop it. Just stop judging people. So, Daisy, back to my question before we went to the break. What do employers do if they have employees that are having suicidal thoughts, or they share that with them?
Well, one, you've hopefully you have a connection with a counseling center, like Community Action does have one with my agency, the Champion Therapy Center, and you have a right to pick up the phone and say, hey, I got this person here who is in need of a crisis session. And if we have crisis sessions available, we make sure that we schedule them like very quickly. And get them in to see somebody, or we may do an assessment over the phone to see exactly where they are so we know exactly which steps to take. So if you as an employer has someone in your office and maybe they're not even in your office, but they're starting to miss a lot of days, their work ethic is starting to fall.
You see a change
you begin to see a change in their normal behavior. And so they may not come to you, but once you start noticing or a management notices, it's time to pull them in and say, hey, are you okay? Like, this is a safe space. Are you okay? You can tell me anything. And then you can start from there putting things in motion, picking up the phone and making phone calls and saying, hey, this is what we have. We have several agencies, or at least one that I know of, that does crisis intervention really quickly, and I think that's Oliver Winston Behavioral Health. They are good at it as well. And so we make sure that we start making those connections. Once we find that somebody is in crisis, we start making the connections. We don't leave them alone and say, all right, we'll check on you next week. Well, we hope they're going to be here next week.
So you're not like, when I call my doctor sometimes, they're like, oh, we can get you in 6 months.
Oh, no.
Not like that.
When we have people call from hospitals, say somebody has been in the hospital because they either thought about suicide or they attempted, by law, we have like 7 to 10 days to get them in. So we're governed to get people in when they're in crisis. And I'm so fortunate to have therapists that work 7 days a week. And so Sunday through Saturday, I have somebody on staff that's working. We have morning and evening appointments, weekend appointments. And so that gives us a different advantage when someone's in crisis, that it doesn't have to be 12 days before they get an appointment. We try to make it readily accessible.
I'm sorry, go ahead.
You have a really diverse staff, too. So you've got, if you want a man, you can have a man. If you want a woman, you can have a woman. If you want somebody black, somebody white, somebody that looks like you, somebody that speaks Spanish, you've got it all. We
try our best to make sure that we cater to the community, and whatever the community looks like is what we should have to service the community.
I want to go back to the employer, because you said, like, if you notice, and I'm going to go from the employer side, disciplinary actions on an employee, how to bring them in, and before disciplinary actions, hey, I'm noticing changing you. I'm noticing this, having a conversation that could possibly, help them more than just the work that they do for you, but their life.
Yes.
And I think that's important in how we interact with each other, regardless of what is going on. Speak to them as a person with feeling and gratitude.
Yeah.
Regardless of what you have to do, because you still may have to discipline, but you want them to know, hey, I'm noticing changing you. Now, this is not your norm. What's going on?
Right, yeah. It makes a difference to feel like you are a part of a community, like somebody cares about you besides you just showing up and punching the clock.
Right.
I was hoping that if COVID didn't teach us anything else, it taught us how to be human again. And how to care about people again. When you can't hug people, now you can. It's like, hopefully we keep those same things that we notice, that we're humans, we're people, like, and check on them as a person, more so than you check on them as just an employee.
Well, I guess I forgot to turn my.
That's you.
Yeah, that's me. I
I swore it was James. I said, James, cut your
And
phone.
I'm
He
like,
said,
I
ain't
don't have a
me.
ringtone like that, so I'm looking at my phone like, be quiet.
So yeah, I turned it on. I never turn it on, but I turned it on so I wouldn't miss your call. And then I didn't turn it back off.
That's all
And so
right.
there we go. Da-ding, da-ding,
That's all right.
da-ding, da-ding.
We forgive you. We'll find you later. All right.
We'll reprimand you later. But that's what Cameron is saying, I think is important for employers. Because if you have a staff person who is normally always on time, and then the next thing you know, they're late, having that conversation about, hey, what's going on, rather than, now you might get the disciplinary action because you got to be on time,
Right.
but finding out what is going on. Is there a situation that's going on?
I know some companies have EAPs, where employee assistance program, where they will pay for their therapy up to several sessions to make sure that their mental health is well. Being one that we're a community together, like an organization doesn't run without people. And so if you don't take care of your people, you don't have an organization.
Right.
And so sometimes we can look, making sure, because the last thing you want is to have to bury your staff.
That's the truth. And when something like that happens, they come to staff and say, have you seen a change? Have you noticed something? Were there any warning signs? I think about the guy that was on Ellen's show and how he was, showing videos of his family and, and then, this happened. And they were like, were there any signs? So in life, we need to be looking at the signs instead of waiting until death and say, well, they did start doing this and I didn't think nothing about it.
Yeah, looking for the signs. They will show signs. Usually people don't really commit suicide in quietness. They begin to withdraw, isolate, if they have means to ways of killing themselves. So if you ask somebody, hey, are you feeling okay? And they say that they're feeling hopeless or whatever, they're thinking about suicide. One of the questions that we ask, like, if you were to commit suicide, how would you do it? And that's a heavy question. But if they were like, well, I thought about shooting myself. I thought about driving my car off a cliff. You check to see if they have means. Like, they can think about shooting themselves, but if they don't have a gun, then there's no way to do it, right? Well, I thought about taking pills. Well, we know if they're on medication, they have access to pills. And so you start removing their access. When kids or people come home from the hospital after thinking about it or attempting, we begin to remove access to things. Like, we do what is called a safety plan. And so they no longer have access to their medication. Their medication has to be in a container and given to them. There are times that we remove doors. You don't get any privacy. I know they're like, that's drastic. Drastic is, look.
It was normal in my house now.
You don't have access to knives. So you don't, I know you want to cut that steak up. We're going to have to go back to little kid days. We're going to cut it up for you. Like, all the things. You don't get to shave your legs. Like, we taking the razors out the room. And guess what? You'll get your belt when you're on your way to school because you thought about hanging yourself. And so we start removing those things. And people say, well, that's so drastic. But a funeral is real drastic.
Yes, it is.
That's as drastic as it comes. So I don't mind that you don't have no privacy today. I don't mind at all, but I get to see you.
Blessed be.
Hey, it's like I get to see you. You are here.
It's such a heavy conversation. It's such a heavy and serious conversation, but it is. And I've noticed in the past that some people, when they're committing suicide and they reach out, they really don't want to die. They're seeking attention or seeking, or reaching out for help, a cry for help. So,
and the last thing you want to do is ignore the cry. You don't want to be so busy that you don't see the signs or hear them saying, "Oh, never mind. I'll just do it later. I'll talk to you about it later." And usually there's an antenna that goes off that says, "Hey, wait a minute, that didn't sound okay."
Right.
And then you have to take a moment, stop your busy life, and say, all right, what's going on?
And so there's help and there's hope.
Absolutely.
And if you find yourself in a situation where you're having some thoughts, you can call 988 and get some help. And you can also, if you're feeling a little bit, hopeless or helpless or whatever doesn't feel right to you, you can call Daisy Brown.
You sure can. My telephone number is 859-359-8352. My admin will be right there to help. They have been trained to look out for the signs of tears and all the things, and we get right on it. We try our best to do what we can to make sure everyone's safe. So please, if you're feeling low, we got you. Call us 859-359-8352.
And just so you know, you guys that are out there, Daisy's got community action too, because we have her on contract, not just for our staff's wellness, but for our families and our parents, because we look at things as we're in a partnership together when we're working with children. We can't work with the children without the parents. Mm-hmm. And so it is really a partnership. And so if you're out there and you're in one of our programs, don't hesitate to call Daisy Brown at the Champion Therapy Center. We want you to. We want your families to be safe and healthy and have all of the good things that life has. Daisy Brown with the Champion Therapy Center. Say that number one more time.
859-359-8352. Call us. We're here.
Thank you, Daisy, for being on the show. It's been another show that we are proud and happy to broadcast.
Absolutely.
Glad to be a part.
You are listening to Lex Talk, More Action.